Okay.
Okay, let's go. Nicole.
Okay, the floor is mine. Okay,
Yes.
so welcome to this Finnish Health Data Hackathon webinar. The title of this webinar is Into to the Wallets and NCP. These are the sponsors. So, Mikael, please correct me if I'm wrong. These are the sponsors of the event. And this is the agenda. We will see 2 European projects presentation, My Health at My Hands, and then we will use the wallet presentation, a presentation of use cases in the projects. We will have a short Q&A after the use case presentation. Then we will have a presentation on testing lab in the European project, the presentation of continuous testing session for HDS, Gazelle, and a demo of Gazelle. And then we will have a wrap up on connection with the previous webinar and the logistic for the Finnish Health Data Hackathon, and we will finish with a Q&A. And this is the QR code of the website of the event, of the hackathon itself. So now it's the turn of EU project presentation, My Health at My Hands and Ikshare. So I think the first one is Zoltan, that is coordinator of My Health at My Hands. And then we will have Argyris, that is the Ikshare WP3 leader. Zoltan, the floor is yours.
Thank you, Nicole. Good morning, colleagues. I'm pleased to provide key information on the project, which is a Lighthouse project. Next slide, please. Incorporating the existing MyHealth.eu infrastructure with the new wallet framework, so the EU digital wallet infrastructure, and as an extension of the MyHealth.eu infrastructure, we will develop a new digital public service delivery framework, so a backbone infrastructure which will enable citizens to access their health record, and with this access we will be providing useful services to all European citizens. Next slide, please. So the project incorporates 45 organizations from 18 countries led by the Irish Minister of Health, and the objective is, as mentioned, to provide a patient-centered, citizen-centered solution framework. And on the next slide, I summarized the approach of the project. So we will be utilizing the European Health Data Space, and the overall objective is to provide services to improve health for all individuals. And during the preparatory phase, we will pursue a co-production approach. So we always provide concepts and then prototypes, and invite different stakeholder groups to add their views on the product concept, and then test them. And by the usage, we will be refine the products which will be launched in 2028 and 2029. We will start this co-production procedure in January, and a knowledge hub platform will be provided, co-production framework will be provided, and the digital showroom is already available with the online continuous test tool, and reference wallet reference implementation, reference mobile application will be available to test all the functionalities we will be providing. So we invite you to join us from January onwards. We will be presenting our solutions in many events in Helsinki, first in January and then during the Athens Digital Health Week, and the IHE Plagathon will be another opportunity to test our reference wallet. So we will invite you to contribute to this product development, and the end goal is to provide the digital public services for European citizens and European stakeholders and providers. I indicated here two disciplines because AI now is an important contributor to all solutions, and AI tools are based on mathematics. So the foundation of the process will be described by mathematical algorithms, and for the best use of these algorithms and the best use of digital capabilities should utilize the knowledge from humanities. So we will incorporate the knowledge from humanities as well. So not only digital innovation will take place, rather social innovation is one important aspect of the project. Thank you.
Thank you, Zoltan. And I think that now it's the floor for Argiri. Argiri, please.
Okay, thank you. Thank you, Nicole. Thank you, everyone, and good morning. So from Exer's side, it's also a big project, I would say, with 40 plus partners. And the main, and probably it's also in the center on the screen here, activity there is to help initially the adoption sites that participate in the project, which some of them are in national level, some others are regional entities, etc., to align with the European Health Record Exchange format, which is then used in different settings. And our main, apologies, just got a drop on Paul. And the main objective and the reason that we are here today is to discuss from work package 3 and work package 4, mostly perspective, the use of the XR yellow button, which then facilitates the needs and the empowerment of the citizen based on the upcoming EHDS regulation. So if you can go to the next slide, please. Now, the interesting part, it's from the Excel yellow button. There are three main functionalities, which are the download, the one-time share, and the linked options for continuous sharing. Right now, the download and one-time share have been implemented and demonstrated in different events. With the latest one was in Vienna, the Connectathon, the IHE Connectathon. And on the other hand, we see the at least 5 main priority domains: laboratory, hospital, patient summary, imaging, e-prescription, and dispensation. Our main focus initially was on patient summary, and in order to support this activity, because a lot of participants were not ready and compliant with the format, we have also introduced a few tools to support these activities. For example, the CDA to file converter, which supports member states who are on the CDA format, probably because of the OpenNCP or other national actions, and this supports them to be compliant with the format. And finally, there is a lot of activity happening lately, and also was part of HL7 working group in Cologne, the initiation of care plans and an extension on IPS for research. And hopefully that gives a quite overview of the project at this stage, and we will discuss more in the use cases later.
Perfect. Thank you, Argiri. Now we have the wallet presentation from Zoltan. Zoltan, the floor is yours. I will switch to the next slide.
Yes, thank you, Nicole. I'm going to focus on the key aspects of the wallet infrastructure. I've copied here the GitHub resource, which provides every details of the framework, and it has been updated. So the complete framework has been updated, and we have now a stable version of the functionalities. From the user perspective, and in the project in my hands and in the digital public service, it will support the user interface and with three distinct functionalities. One is identification and authentication, and this provides interoperable, uniform way for all European citizens to identify and authenticate themselves. And not only individual wallets will be available, rather business wallets. So if somebody is a representative of an organization, the wallet can be used for this identification, for this role as well. And health professionals will be able to use the wallet for their identification at their workplace if the organization decides to use this opportunity. So the wallet itself will be a widely used tool for identifying and authenticating individuals, and from the end of 2026, it will be mandatory for all member states to issue at least one free public wallet for all their citizens. We know that in some countries there will be some delays, but in roughly in a year in all member states. So for all of us, digital wallet, eIDAS2 conform digital wallet will be available to use. On the other hand, it will not be compulsory to use. So it will not be mandatory for us as citizens to use the wallet. It will be an opportunity. And the method comprises two different use cases. One is the online use case. So remote identification, authentication can be managed. And the other one is the so-called proximity, the close proximity use case when no online connection is needed, rather NFC or Bluetooth low energy connection is providing the route for connecting the devices and for data transmission. So this is, we could say, the most important functionality of the wallet. The other one is the presentation of attributes. So we can incorporate, we can download, retrieve different type of documents, and this can be a mobile driving license, this can be a social security identification or a patient identification according to the national document setting, or certificates will be stored in the wallet and can be presented after identifying ourselves as citizens to a relying party. I will come to that architecture in a minute. And the third functionality is the digital signature. So we will be able to digitally sign a document in our mobile phone. So there is a device-based signature, and the other opportunity that a certified provider we are signing the document at a certified provider, and the digital signature is provided this way. Next slide, please. This is a summary of the latest update. So these are the components of the stable architecture and reference framework and the reference implementation. And there are different use cases mentioned. Tickets, bookings can be included. This covered by the travel use cases. diploma, as mentioned. Next slide, please. And both Android and iOS framework is supported. There are different functionalities, components available for Android and iOS presentation. For the wallet use, I will highlight the health-specific implementation. So we can say that the wallet will bring a gateway to patient autonomy. The wallet is person-centered by design because all the connections, all the transactions must be initiated by an individual. So this will be the basic principle for the design in every wallet-related workflows, and this will serve the health use cases where the data loop will serve the processing of the data presentation, and then the repeated use will enrich the data set we have, and this enrichment is always managed and controlled by the individual, so the wallet will play an important role. And as an attribute, as a digitally signed document can be incorporated into the wallet, consent management will be very well served by wallet functionalities. Next slide, please. So this is the current MyHealth at EU-based scenario, and there is an ongoing change proposal to the MyHealth at EU infrastructure. So from next year, it will be available for all national e-health authorities to include the wallet-based identification of the patient. This needs a special credential issuance. The wallet itself contains the PID, personal identification, so we will have wallet providers and we will have PID providers. And additionally, for the health use case, when international search mask describes the use of other identifying attributes than the personal identification, so patient insurance number or specific patient number, patient identifier is needed, then health ID is a different attribute which is added to the PID, and this health ID must be issued by country A, so the country of affiliation, and the NCP issues the health ID which is included in the wallet, and this PID health ID identification attributes are presented to a country B relying party organization. So we have important players here in the wallet infrastructure. One is the wallet issuer. As mentioned, in a year, all member states are obliged to issue at least one free public national wallet. There is the PID issuer. And here we have the functionalities of the issuers and the relying parties. And this additional functionality will be included. When we go further, I will present the forthcoming infrastructure. So the next slide, please. This describes the wallet-based infrastructure. So here we can include many different type of credentials, documents into the wallet. So presenting attributes can be a PID, a health ID, a photo ID, a document ID, patient summary ID, for example, or allergy card, immunization card ID, or a section of a document when we use the FHIR standard, a document itself, as mentioned, at mobile driving license or a ticket. So this will be an allergy card, for example, or deep links URLs can be included. And these are issued by an issuer, a registered issuer. And as we survey the different solutions in different member states, we can here differentiate an issuer organization and an authentic data source organization. So in some countries, for example, lab results will be issued for cross-border use by one national issuer authority organization, and all laboratories in the country will provide data as authentic data source to this one single issuer. It can be a national or regional issuer. It's important that for health, the credentials are encrypted or coded in MDoc. So credentials to the wallet are provided according to the MDoc standard. This is available on GitHub, and data sharing can be presented remotely or, as mentioned, in a proximity case when NFC and Bluetooth Low Energy is used. And as we will be using FHIR-based documents, then different bundles, data bundles will be available as coded in an MDoc format and included as documents in the wallet, as mentioned. An allergy card can be one example, or immunization card, which will be developed in the EUVAC project, will be one important use case. So either the national language can be used here, or a translated English, or a translated country B language can be used. So this is the overall architecture of the wallet infrastructure. The trust framework is being explored, so we are not able to report you all the details of the trust framework. However, all issuers, wallet providers, and relying parties will be registered, so there will be a registry, and the registered organizations will be verified when the connection is established. So all issuers, all relying parties, and all the wallets will be included in a European-wide registry. Thank you. That was the overall summary of the wallet infrastructure.
So thank you, Zoltan, for your interesting presentation. Now we want to introduce you to some use cases that we have developed or that we would like to develop in the EU projects that were presented before. So basically, ICShare and My Health at My Hands. We will have three speakers, Sofia Franconi, Argyris, and me. So the first part is fully related to ICShare. So we will have Sofia. Then we will have a slight change from ICShare to My Health at My Hands. And in the end, we will see also a use case taken from ICShare for 8 weeks. So please, Sofia, the floor is yours.
Thank you, Nicole. So I'm going to present the 2 use cases that we have developed and tested already in Xshare. So the first one is the one that you see here on download and upload. So our big goal for this use case was to see if the adoption site and the people that were testing were able first to create an IPS document on FHIR format. If that was not the case, the project developed a converter CDA to FHIR to move the document from CDA to FHIR and have them validated. So with against the Xshare FHIR implementation guides in the Gazelle tool that we have. There was an optional step when we tested it, was about the authentication and see if the user was authorized. I think this year we'll be able to go further with this step with what Zoltan just presented. Then specifically for this download use case, we used the yellow button in the application of the different adoption sites, see if they were able to download the IPS by clicking on the button, and if another actor, so consumer, could upload this IPS and see it in their application. So if you go to the next slide, please, Nicole. So here is the one-time share. So basically the preliminary steps are the same. So to be sure that we have an IPS that is ready and validated, that we have the optional step for the authentication of the user that will go further, I think, this year. And then for this one-time share, there was a filter step to see exactly which document we could generate a link for it. So to generate the SmartElse link and to copy it in the test to be sure that someone else can retrieve this link. Retrieve this IPS by using the link with the access via the access of the manifest and so the access of the document. So I think that's all for these two use cases.
Thank you, Sophia. Then it's time for Argyris.
So indeed, I'll start first with my health, my hands use cases, and then we'll see the merge of some common things. The first use case is the authentication of a user in online pharmacy context by the online pharmacy requesting the health ID and PID attributes in order to authenticate the citizen and be able to retrieve the prescription, ideally through the OpenNCP network, at least for this stage. And the dispensation part is out of scope because until now we have identified a lot of difficulties there, but we have a lot of time to figure out how this can be implemented on a later stage. And the second use case is the is here to provide an MDoc with a current medication list, the allergies or vaccination information to the wallet. And this may come also as a synergy with other projects like EUVAC and I don't know who else could contribute on that. And on that stage, we are missing definition for the namespaces that may be needed there. And on a parallel track, there is some progress on this, hopefully. And I expect early new year to come with more information on the later part. Next slide, please. Now, the third use case, and it's probably something that can be easily tested, is the use of the Xshare yellow button to act as an issuer for the wallet. And the initial idea is there when the citizen is going to download the medical information to be imported in the wallet, either as a smart health link or to provide some kind of similar as the use case to the namespaces and have this information in the wallet. And I think I don't have another slide, if I'm not mistaken.
No, I don't think so. I think the next one is mine. So basically also for I2X, that is the a project, a U project related to the real implementation of the format. Basically, for that use case that we would like to propose to the project, we took the skeleton from Xshare. So the idea is to prepare the clinical document like it was done for Xshare, in line with the implementation guides. Then we have to define a way to exchange the document, because there is no actually clear specification for sharing within the I2X project. And for that, we had the idea of using, and we proposed that to the project, to use the IG profile like MHD for query and retrieved file documents, and we will use option of this IG profile that is sharing simple documents, not the full IG profile. And then the idea, as was for Xshare, is to show that the consumer is able to see the document through a screenshot or both, in a computer readable format and or in human readable format. So these are the use cases for the EU project. So we will have a very short Q&A session if there is any question for the presentation that we have had so far. Otherwise, we can continue. So I think we can continue. So next presentation is the testing lab approach in the EU project, and for this Alexander Berler will present for us. So Alexander, the floor is yours.
Thank you very much, Nicole. So let's go to the next slide. So we have within IHE, we have created this concept of interoperability labs. That it's a way of being able to test early on things that are not yet fully standardized or mature, or innovative use cases of things that are coming up and that we would like to bring to the standardization community for profiling and testing in the future in a more thorough way. Knowing that the digital health is really evolving rapidly with a lot of new use cases, and the three projects that were previously mentioned are a very good example of this evolution. So for that, we have created a version of Gazelle with some additional tools that I guess we will have a demonstration about it just after. Next slide. So this is more or less the current approach of IHE, trying to reuse the same concept and sometimes, and if possible, the same testing tools from the early stages of creating a use case of digital health or interoperability, and gradually move to more thorough testing like the standardized IHE profiles in the IHE connectathons, or orchestration of well-formed and mature specifications into projectathons that can be any type of projectathons from a European projects, a region, a country, or even cross-border. Next slide. So more or less, in the context of IHE, we have a very specific process how to mature a use case from its early conception. So the first part is always that we need to discuss the business case. We have first of all to discuss the business case behind the use case and try to map it with existing specifications and profiles. Then create the test scenarios and start trying to align the use case with the testing part. And of course, if you do testing, then you can do test reports at the end. Next slide. So in that sense, for the this approach, we are trying to develop a testing strategy here for the innovation part, especially related to the early adopters of the European Data Space regulations, trying to realign as many projects as possible to try to use the same testing tools and the same components, like we presented just before. So the idea here is that the regulation is going to enforce what we call the interoperability component, which is in practice the exchange format, the EHR exchange format. But we need to do much more than just content testing. We need to put the documents or the file bundles or all these nice specifications that are being created right now into implementable use cases. So we need to put it in the clinical context. And this is the role of this approach. In that sense, then we can try to perform different types of testing, which we want to experiment also early on at the stage of hackathons and plagathons. And at that part, we can always align it with educational sessions, raising awareness and building capacity building. Next slide. So in this testing continuum and this testing strategy, as said, we have different types of events that we usually do, and we want to use the same interoperability lab for all the different stages, meaning plagathons, and hackathons, the concept of the projectathons, and all, of course, the IHE connectathon. So try to give the same type of services to the ecosystem so that they can use the same tools for different purposes. And we will, if you manage to come also and join us during the IHE Connectathon week, the last week of March, you will see all those three lines of testing active on the same place. Next slide. So in IHE, we have at least two types of testing we are specifying. One is the no peer testing, which means that you don't test, it's you bring your system and you test it against simulators and validators. So you try to see if your system is compliant with some basic specification initially, or based on a conformance scheme of any quality and maturity. The other important thing is what we call the peer-to-peer testing. So we try to bring two systems that have complementary roles. So for example, one is a content creator and the other system is a content consumer, which means that then you can do also end-to-end testing involving different actors and transactions, and sometimes even more than one or more IHE profiles or other set of specifications like FHIR implementation guides, for example. Next slide. So in that sense, the concept of the lab is mostly about trying to bring into motion and align projects in the concept of co-creation, performing tests before implementation, align testing with in a continuous way so that we are providing testing tools along the creation of the proof of concepts, the prototypes or the products. The idea is to create an ecosystem of people initially that works together. So try to reuse also the ecosystems that are coming from the supportive projects, like the 3 projects that have already been mentioned, and also increase through that process the capacity building and to raise awareness on some set of specifications and capabilities within the people that are part of the ecosystems of different stakeholders. So the participants that are using the lab can be both from the vendor side, but also from the user side, the ones that are in the demand, but also the ones that are on the supply side, let's call it this way. Next slide. So for that, and you will see a demonstration, I guess, just after, we plan to use the Gazelle set of tools that, as in this slide, it's split into 3 groups of tools that we will have. We have the Gazelle core, which is mostly about the peer-to-peer testing and the event management. We have also the set of Gazelle tools that we use mostly to support the IHE-based testing events, the connectathons, more or less. But for all the rest, we are able now to connect to Gazelle a lot of third-party tools. So that is an ecosystem of connected testing tools or sandboxes or referent implementations that could act as simulators as well. And this is what we plan to do at least in 8 weeks and my head at my hands by introducing also other type of testing tools and test plans that have been created by previous projects like Potential and Patet, for example. Next slide.
It's mine.
And the next slide is yours. So back to you.
Thank you, Alexander, for this interesting presentation. Now I will present you a bit the continuous testing session for HDS. This continuous testing session is included in the testing continuous that Alexander presented you before, as you can see also in the figure in this slide. And the continuous testing session for HDS is a tool that supports the HDS related projects like the ones that we presented before. And it acts as a preliminary and preparatory step towards the HE Plagathon and Projectathon activities, and it offers both a training opportunity and a chance for vendors to collaborate and support teams between the events, and you will be able to see a bit the continuous testing session for EHDS also during the hackathon. Just to explain a bit the 3 pillars of this continuous testing session. There is no peer testing. Alexander also explained before what a no peer test is. It's focused on validator and simulator without peer-to-peer evaluation. Then we will have the role of the facilitator that are persons, subject matter experts who will follow, help and guide the participants throughout the process of testing, offering guidance and support. And then we have also prepared an online space to support communication and collaboration using Zulip. So this is, of course, the first step. New things are coming. In fact, the idea is to adapt the continuous testing session for HDS based on the requirements, and the needs of this project that we have presented before. Basically, share my head at my hands and I2X for now. And putting new things into practice, like, for example, the new validators and the introduction of simulators, the idea of peer-to-peer testing, and the automated test cases. So this is my last slide, because now I want Angael to present Gazelle, and she will do also a demo for us on the continuous testing session. So Angael, the floor is yours.
Thank you. Okay, so I will just introduce briefly the Gazelle. I mean, either you are familiar with it, either it's only, yeah, well, I will give a quick overview. So please, next slide. And we developed Gazelle with the purpose of supporting the IHE Connectathon. So development started 20 years ago now. And the mission would then, so IHE enforces and make sure the specification are ready by offering tests to the vendors. So how to support that? So with the Gazelle testbed, you are able to do some peer-to-peer testing. It's what we are doing during test events like Plagathon, Projectathon, or Connectathon. You can also orchestrate tests that involve more participants. We call them group tests. We usually use those tests for testing workflows during Projectathon. When we have real use cases to test, and conformity. So conformity is used as no peer testing, testing against tools. So it can be used either in a lab to assess conformity, get a stamp or whatever, or it's also what we used for the continuous testing session. Next slide, please. So Gazelle is an open source testbed made of several components. It's used internationally, so for the Connectathon in Europe and in North America, but also for many Projectathon and Connectathon in Asia as well. it's collaborative. So Curaval is the main developer, and we are working with other parties, especially to integrate third-party tools within the Gazelle ecosystem, and adaptable in the sense that Gazelle is developed with the purpose of testing the IHE specification, but it can support extension of the IHE profiles or totally different profiles, and not only in the field of e-health. Next slide, please. And as Alexander as shown on a previous picture, so Gazelle interacts with several tools. So we are not reinventing the wheel, we just reuse and integrate with other components like Matchbox for the fire validation, ITB in some European and WHO projects, and other tools from the community. And I think it was the last slide for the presentation, right? Or there's one more? No. Okay, so let's move to the presentation, and for this I need to share my screen.
Sure. So I should be able to present.
Yes. I will just this. Okay. Oh, sorry. Okay, so now we should see Gazelle, right?
Yes.
Okay. So this is the instance of Gazelle. So for each project, we set up a dedicated, or for each customer, you can have several projects as we have for EHDS. So for each of our customer, we set up a dedicated Gazelle instance. So everything is separated, and every customer can just have his own set of tools with its specificities. So this EHDS Gazelle testbed is the one we have built for the lab that Alexander described earlier. And it hosts the test for several European projects. The main tool you will be using when doing continuous testing session is the test management tool. That's the tool that we use to manage the systems under test. It is where you will find your test plan, where you will report the evidences, and where the observers will review the test cases. The validation portal is a tool that is used to, perform some ad hoc testing. So you can simply come with your document here and find the validator of interest to you. So we have categorized the validation profiles based on where they come from. So we have the European IGs for the format, the IGs for the cross-border. So for example, the lab report coming from MySATU. We have internal IGs like IPA and IPS. And then you will find also validators from other EU projects that relates to MySATU. And we have some IHE profiles as well. And when you come here, and it is what you will be asked to do during the continuous test event, you can just access the validator. Let me check IPS here. You say validate. You upload your file. You check it against the bundle IPS. And when you validate, you are actually calling Matchbox, who is performing the validation, and you will get back the test report. Yeah, so you see that everything is passed, and you have a few summary about what has been checked by the tool, and you can review the file that you have submitted. So it's basically what you have to do when you do the continuous testing. How it works in, again, in test management. So I'm switching back to the home page. And the message capture here is used during event because it's a man in the middle. It will just collect all the messages that are exchanges between participants, so we can browse them and we have a common way of reporting them, and you can validate them with our set of validators as well. In test management, so you need to be logged in and to access the continuous testing session. And from here, you will you need to have registered your system on the test. So you have a registration section here where you can create your systems on the test and tell us what are the capabilities that are supported by your systems. So are you a creator for the IPS or whatever? And then when you switch to the testing, you will see, so today there's no system registered yet, but if I go to the demo session, you will see that for each system, so if I take, oh no, let's take this one, for each system, there's a list of test cases. So for example, this content creator supports both e-prescription and patient summary. So we have two sets of test cases to be executed. So one for the prescription and one for the patient summary. When you create your test here, you will find the description of the test case. And so this is not so useful because that's not peer-to-peer test, but that the sequence of actions that you will have to do to execute the test case. And here you can find your, the test steps where you will put all the evidences. And then when you're done, the test will be, so you need to follow the instruction. And when you're done, you will simply mark it as completed for the monitors to review it. I think this is all for the continuous testing session. Yeah. Nicole, back to you.
Thank you, Angal, for the presentation and the demo in Gazelle is always interesting. There is only one slide more from your side, I think. If you want something, I think we missed to present it before. So I'm not sure. Are you able to see it?
Yes, okay, so it's just the setup that we had for the connectation in Vienna. So Gazelle test management, so as I show you, is where you will execute your test cases, and we leverage Matchbox for all the IG-based validation.
Okay, thank you. Thank you, Angal. And so I think now it's the turn of Mikael. Wrap up and connection with the other webinars, and after that, the logistics. Mikael, the floor is yours.
Thank you, Nicole. Let's go to next slide. So a bit of overview. This is a part of the larger Nordic Health Data Hackathon series. We started in Norway in EHIN conference in November. This session in Finland is the second one, and then we go to Vitalis in Sweden in May, and then to Denmark in autumn. And we are planning to make this a continuous rotating series of events. So that's a bit of background. Let's go forward. There are many things happening at the same time in Helsinki. So there is the 30 years anniversary symposium of HL7 Finland. You can find more information about this. Next slide. There's also the Radical Health Festival, and that's a big international audience event in Finland. And we are in the same premises with them, with both the symposium and the hackathon. And the next slide. And then on Wednesday, there will also be the Finnish domestic Doctor Days event. So that's more for the Finnish audience, but also a good time to reach healthcare professionals and discuss with them. And we are currently planning to have the end results of the hackathon presented just between these conferences on Wednesday when the Radical Health Festival closes and before the Lääkäripäivät begins. Let's go forward. There are 2 tracks in general in the hackathon. There's the patient access to health data track with 5 different topics. And then the next slide, there's also the care plan track with clinical reasoning. So many different use cases. And as you saw, we are here, one topic of the patient access track. Let's go forward. And all of this I'm now running through, but we have had these intro webinars already. So if you want to know more about the general intro to the hackathon, go to the hackathon webpage and locate the section for webinars. So all of these are recorded and the presentations are shared there. And I'm hoping to get this recording up there later today as well. So then we'll have in total 5 different webinars. Then let's go to the logistics. What do you actually need to do? So when and where? It will be Monday, January 19th. And we will start at 9 a.m. sharp. And I think that's a typo, it should be EET. Well, anyway, Eastern European time, Finnish local time, 9 a.m. Be on the venue. And the venue is Messukeskus. And that's kind of not the actual big convention center. You need to take a separate entrance, and that's for meeting guests. So there's a different conference wing, and we will be convening there in room 203. And as said, Monday is the main day for the hackathon. Some tracks like this track will continue on Tuesday, and then we have some final thoughts of each of the tracks and then present the results publicly on Wednesday. Next slide. Participation, you need to register in advance. Doesn't cost you anything but time, but please do invest that time. If you go to the next slide, I think we have a screenshot of we have a screenshot first of the hackathon webpage. So at the bottom, you have the participate section, and then there's this highlighted section asking you to fill in and submit the registration form. And the next screenshot is about the form. So this is what you should be going through. And this is mandatory. But then in addition, we have, go to the next slide. That's good. We have a Google Sheet specifically for the patient access track. And this is, if you want to share before participating what you'll be doing, what you're interested in, please fill in this Google Sheet as well. And that's your opportunity to tell the organizers of the hackathon, hey, this is what we'd like to do. And also reach out to other track participants. Hey, we have this cool thing, you have that. Can we get these talk to each other? Or if you want to further evolve some of the NCP stuff or the wallet stuff, share that, and then we get a good overview of who's coming and what everybody wants to do. And that's really the key to making the hackathon a success. Do we have more slides? Yeah, that's just screenshots of the Google Sheet. So there are 3 different sheets. One is for the participation information. I filled in sensor trends information as a placeholder or example. And then we have 2 other slides on the bottom. So one for presentations. If you want to give a presentation, please submit it here and we'll figure out a place where to have these presentations. And then there's still a 3rd sheet for ideas. So if you have any ideas you want to highlight before or during or after the hackathon, then this is a place to collect those.
And I think this is the end. Yes.
Yes. So this hackathon is organized by HL7 Finland with support from other Nordic HL7 affiliates, then HL7 Denmark, HL7 Norway, and HL7 Sweden. and sponsored by City of Helsinki and IHE Catalyst and SensorTrend. And we are really looking forward to seeing you there. Are we ready for Q&A?
Q&A session, if any.
I see there has been a lot of discussion in the chat, but I think especially Zoltan has been answering many of those questions. But now is a good time for wider discussion.
Yeah, that was related to the Wallet Trust framework, and as I mentioned, we are still exploring the Wallet framework, so we have much more questions than responses. But the overall conclusion, what we can conclude here from the discussion, that for the e-prescription, e-dispensation use case, we are quite far to transmit this from the current EHDSI test-based very well established service solution to the wallet framework. So this is a critical use case, and we will need another 2 years until we will be able to establish this service in the wallet-based framework, if it is possible at all. So yes, and what was the other topic is the relying party, registered relying party, and ETSI standard describes the wallet trust framework. So as mentioned, all issuers and relying parties must be registered because the case will be identified. So always the registered parties will be verified when the connection is established. So these are some important additional elements to the trust framework as a conclusion of the discussion in the chat. Thank you. Thank you, Mikael.
Thank you, Zoltan. Adam, go ahead.
Question about the EU digital wallet. Are package leaflets in scope? So will I be able to put the package leaflets of my medications into the wallet to read them at any time?
Yes, they have started to explore the outcome of Gravitate Health, so the electronic patient information provided by EMA. So this functionality and this service will be included. So the conclusion is that yes, official package leaflet will be, so there will be the opportunity to include the package leaflet in the wallet, yes.
Thank you. That will be very interesting for us in Felleskatalogen, I think. And also a second question about the wallet. How is dual citizenship going to be handled? So will I, for example, have a Norwegian wallet and a Hungarian wallet, or can I link those two together in some way because I'm the same person?
I do not really know. I haven't met this question yet, so, but I will ask my colleagues, and we will be able to provide the formal response to this. This is very much related to the current situation. So probably, okay. The best answer is that we will review it, and we will be able to provide a formal response to this query during the hackathon. So we will prepare a response to this.
Perfect. Thank you.
Thank you, Zoltan. Any other questions? I can ask Angel about the online testing tool. First, is it correct that it's only for EU projects currently? So not anybody can just log in and start using it.
Yes, exactly. But I think Nico know better than I. But yeah, it's for today only open it to the partners to the project and to the participant to the plugin.
Yeah. Good. So it is open for people on the hackathon. So next question is, how will you populate? Do you have plans for that? What kind of test cases will there be? Will you repeat what was available in Vienna?
So maybe
Will there be some new stuff?
I can answer on that. For now, we will have available only the test cases that were available in Vienna in the plugin, because this was done for the European projects in order to let them prepare to the test cases, to start using Gazelle, to start familiarize with the test cases. So but as I said before, we would like to adapt it to the needs of the project. So we have in pipeline after the connectathon to introduce some validators for My Health at My Hands, for example, and Kereval is working in the context of My Health at My Hands to include also simulators for wallet issuer and verifier there, but this will be for Brussels. So the idea now is just to familiarize a bit with the test cases.
Sure. And I think the test cases, I was in Vienna, I think those were valid already. So you can validate the IPS you produce, for instance, and lab results and all of that. So should be really welcome to hackathon participants if they're working on any of the EHDS content formats. And then I also think that's excellent opportunity to kind of launch, even though it will be kind of an online tool going forward, then to launch it at an event where people are physically present and are able to share their experiences on how they use it. Good progress. Any other questions or comments? If not, please do register. You need to register to the hackathon separately, and then you can register to Radical Health Festival, Lääkäripäivät, HL7 Finland's 30th year anniversary separately, and then please share your ideas on what you want to do on the patient access track on the separate Google Sheet. But the most important thing is to register for the hackathon. That's how you get in. Thank you, everybody, and looking forward to it. Let's meet in Helsinki.
You and see in Helsinki. Thank you. Bye.
Bye.
Thank you.
Bye.
Bye-bye.
Thank you. Bye-bye.
Thanks, bye.